Understanding the life cycle, disease and the prevention of hookworm, the blade-sucking parasite. Hookworms are parasitic roundworms that live in the small intestine of their hosts, including humans. They get their name from the hook-like mouth parts they use to attach to the intestinal wall. Two main species infect humans, Necator americanus, which is the most common type, and Cyclostoma duodenale. They are categorized as soil-transmitted helminthiases. Hookworm affects hundreds of millions of people globally, primarily in tropical and subtropical regions with poor sanitation. It's a leading cause of anemia in developing countries. Children, pregnant women, and the rural population are at the highest risk. Infection begins through fecal contamination. Eggs from an infected host are passed in the feces and deposited in soil. Then larval development starts, in this case in warm, moist conditions. The eggs hatch into the larvae. Then skin penetration follows. Infective larvae penetrate the skin, usually when a person walks barefoot on contaminated soil. This is followed by migration. Larvae travels through the bloodstream to the lungs. Then they are caught up and swallowed, allowing them to travel down the esophagus. Once in the small intestine, they mature into adult worms. They attach to the intestinal wall and they feed on blood. The female worms lay eggs, which are passed in the feces to continue the cycle. When we came to symptoms of an infection, symptoms starts with skin manifestation. An itchy, localized rash known as ground itch may appear where the larvae first entered the skin. Then, intestinal symptoms such as abdominal pain, cramping, loss of appetite, and diarrhea follows. The most common sign is iron deficiency anemia due to blood loss from worms feeding in the gut. This can cause fatigue and weakness, pale skin, dizziness, and other complications. In children, chronic infection can lead to physical and cognitive developmental issues. The most common diagnostic method is microscopic identification of hookworm in a fecal sample. A complete blood count may show eosinophil, an elevated white blood cell count, and iron deficiency anemia. On endoscopy, in rare cases, it may reveal adult hookworms which attach to the small intestine. The infection is typically treated with anti-parasite drugs such as albendazole, mebendazole, and iron supplementation. Iron supplementation are crucial for patients with anemia to help replenish red blood cells. In addition, severely infected individuals may need additional nutritional support. To prevent hookworm infection, avoid walking barefoot in areas where soil might be contaminated. And also improve sanitation. Use proper toilet facilities to prevent fecal contamination of the environment. Wash hands with soap and water after using the toilet and before preparing or eating food. Do not use untreated human feces as fertilizer. Thank you for watching.